Hello, hi, Healy friends and family. Thank you so much for joining us today. Thank you for giving me 1 hour of your time. I know that everybody is busy, but for you to make time to join me today, I will give my commitment to share whatever I know and help you to get to know to use the Healy properly and harness the power of Healy for your daily lives. Okay. Yeah, I'll do my best. And today we're going to talk about the strong foundation, how to build a strong foundation for our health. Okay, in terms of our body, our mind, our soul, using both the Healy and the MagHealy. Okay, so the disclaimer first. All right, so this is the disclaimer for Healy World that the platform that we have here is provided by Healy World. Thank you to the company for giving us this opportunity to for sharing and exchange. All right, the information that we share here is for education only. Yeah, and whatever information that we share here, so Healy World is not responsible because we are the ones who will have to judge and evaluate the information that is shared over here. Okay, now with regards to the Healy and the MagHealy devices, they are not medical devices and therefore they are not intended to cure, to treat, mitigate, diagnose, or prevent any disease or medical condition. So should you suspect or have any medical condition, you are advised to seek professional help, but at the same time, you can use Healy to support yourself, support your body. So this is my disclaimer that the intention of this session over here is to share my own personal experience, right? My own personal experience. Yeah. While using Healy and MagHealy for now over 3 years now. Yeah. So there are many, many ways to use these devices. It's very versatile. Okay. So therefore, when you learn from different teachers, different individuals, adapt their practices to best suit you so that you get the best and optimal outcome for yourself. Okay, so do not believe everything that is shared here without applying discretion because our body are all different. So therefore, we need to adapt according to what will suit us. All right. So microcurrent or frequencies, they are energy forms that is applied to harmonize and balance the bioenergetic field and the information field of a person. So because our body is all different, so therefore the results will vary from case to case. Okay, so a little bit of my background for those who are new to our sessions here today. So if you are here for the first time, we welcome you. And for those who have been around have been following us, okay, we are very thankful for your commitment. For me, I'm very thankful for your commitment towards learning how to use the Healy and the MagHealy devices properly. Yeah. So my own personal background is I was first exposed to bioresonance in 2017. So at that point in time, machines are all big and huge, not like our Healy that is so portable these days. Okay. So I started then about 8 years ago. And since last year, I've only used the Healy and MagHealy for energy profiling work. Yeah, so my clients are those with either health issues or relationship issues or anything, okay, that is pertaining to their life. So we use and adjust the energy in order to raise our energy so that whatever that we want, which is of higher energy level with our current state, we are able to move closer and closer to our goals, to what we want. All right, so that is my background. Okay, because I'm in teaching, I also have my certification in professional counseling. I'm trained in the Chinese Meridian systems, and my initial calling, okay, my very first calling and passion is an educator, which I'm still doing. Okay, I'm still teaching, I'm still educating. Yeah, so I started my career as an A-level biology teacher in Singapore. Okay, so I'm a lecturer. So, but since 2012, officially, I stepped out of the school system and then started wellness training and education. Yeah. So as a teacher, when I first started teaching the use of Healy, at that time, there's only one device. Okay, so I received the same questions over and over again. So the natural solution of a teacher is to compile the answer for all the questions into books, you know, and that's how these 5 books came about. Okay, so these 5 books become my resource for my team members, and then later on it expanded to other teams and all of the entire Healy family. All right, yeah. So so today we are going to talk about this topic, okay? Because the topic that I gave today is to, okay, you can't hear me properly. Okay, because today the signal is a bit weak. Yeah. So is it a bit laggy? You may just have to make do with it because I'll try to speak slower. Yeah.
It's fine.
Okay. So yeah, so my topic is we are talking about health for everybody. All right. So how do we talk about health for everybody when there is so many
Active music works. Bluetooth mode. Connected.
Okay, so therefore, I thought of a way to actually help us to make things very simple. Because as a teacher, whether in school or here, my job, my calling is to make things simple. Sometimes I will teach the technical part, which is complicated, and then sometimes we can actually make things simple and look at the overview. Because we have to look at the forest, and then we also have to look at the tree. So sometimes I give you the tree, sometimes I give you the forest. So today I'm going to give you the forest view of what is going on in our body here. All right, so what are we going to talk about? Now, I structured today's talk based on the questions that I've been receiving. So usually after the 1 hour, I answer a lot of questions from you. And from the questions, what I sense is that people are quite confused, that there are so many programs or so many diseases, and then fearful that if I use this, will I be wrong? What if I'm wrong? Will there be any consequences and all that? Yeah. So there's fear, there's confusion, so many diseases, how to handle, and you know, at the end of the session, everybody will come up with, oh, what about this condition? What about that condition? What do I use for this condition? What do I use for that condition? So it seems that people are confused and think that things are complicated, but it is actually not that complicated. Okay, so it's like learning, you know, as we learn from kindy, nursery, and then after that you have the kindergarten, and then you have primary, you have secondary, and then you have university. All right. So that means when we learn either at the nursery or kindy, what do we learn? We actually learn the alphabets, right? All the 26 letters. All right. So because that is the foundation. If you do not know all your A to Z, how are you going to form words? How are you going to form sentences? You can't. You actually have to start from the foundation. Okay, so I'm going to keep it very easy and simple today by going to the core, going to the foundation, the essence of health. And using this system here is universal, is for anyone, whether you are 20 years old or 50 years old or 80 years old or 90 years old. All right, so we have had individuals who are in their 70s, late 70s, and asking about programs in Healy and all that. Doesn't matter. You can be in your teens, you can be in your 80s. It does not matter because what I'm teaching you is actually universal. Anytime, day, night, and all that, you can use it anytime. Okay. And I would say that this is my method because I haven't seen it in the publications or official teaching where they learn this method, but from my analysis with people and from looking at over 500 cases, yeah, I do see certain patterns, and I'm going to share with you what is the pattern that I see. All right. And what I'm teaching for you today, if you were to diligently follow it, okay, it is going to set a very good foundation for your health. Okay, now this is what I wish I knew when I was 20. Okay, yeah. So because there are so many diseases, yeah, when you hear from people, they will say, I have this, I have that, and all that. But actually, when I think about it, I only place them into two very, very broad categories. One category is the acute or sudden, unexpected. For example, COVID-19, suddenly it appear. It can be life-threatening, okay? It's an external threat. The threat is actually coming from outside. For example, infections, bacterial, fungal, viral infections, parasitic infections. Now, the other threat to our life is accidents, okay, fall, injury, or contamination. Yeah, eating food that are contaminated with either pathogens, okay, germs, or chemicals, poisons, toxins, and all that. So these are threats that can affect us suddenly, and the body may be overwhelmed and unable to respond immediately. So for this kind of issue, we really need to go and see the doctor and get it addressed. Now, the other broad category of issues are actually classified as chronic. That means they progress in stages from mild, and then it get progressively more and more serious in stages. They are quite predictable. Okay, so meaning that if you do this, that means, like, for example, if you smoke, this is going to happen. Okay, you will have lung respiratory issues. Okay, if you eat too much of this kind of processed food, after that, what is going to happen to you? So it's quite predictable. When something is predictable, it means that something is also preventable. Okay, it's reversible because a lot of it is actually from our lifestyle. So it's actually an internal threat. It's coming from within. So the stages that we see, okay, so for this kind, to solve this type, we actually need discipline, all right, discipline. Now, this is the progression of the stages, all right? This is what I summarized and came up with this pathway. The more I use Healy, the more I see clients. Yeah, so this is how I see as the progression of this kind of chronic diseases. And a lot actually start with negative thoughts. When there's an event, it depends on how you actually respond to the event, positively or negatively. So when you respond it as a threat negatively, then what happens is you have negative thoughts, and that will lead to negative feelings, okay? And the negative feelings will then progress to disrupting energy flow in the body. Yeah, so when the energy flow in the body get disrupted, it's going to disrupt fluid flow. That means our blood, our lymphatic fluid, and then our electrical flow, okay? Yeah, the nerves and all that. So it's going to affect the homeostasis, which is the balance inside our body. And then all this will then result in cell organ dysfunction. Okay, so things starts to break down and fail internally, and then it will surface as different symptoms. All right, so this is how things progress. Now, what is it that I wish I knew when I was 20 is this, that all these health issues and symptoms that we talk about actually started from here, our negative thoughts and our negative emotions. So if I had known that this is the thing, I would have responded and reacted or dealt with situations and events very, very differently. Okay. All right. Now, okay, so what would be the roadmap? I'm going to put in place for you all the 200 over programs that we have in Healy. So if we were to follow this, that means it depends on what stage you're at. If you are young, healthy, in your 20s, in your teens and all that, okay, you are probably here. A lot of it are actually your thoughts and your feelings. It has not yet progressed later to the more severe stages, okay? Now, if you are here, starting to feel a bit of discomfort, and then later on your symptoms starts to appear, yeah, and you start to get alarmed, these are the later stages. So regardless of where you are, okay, so this is how we can actually slot in all the different programs from Healy. All right, now, if you are at the state stage of thoughts and feelings, this is what we do. Okay, using the database of Alaskan gem elixir. This is the Australian bush flower. This is the bug flower, creative homeopathy, psyche, courage. And then you have plant power. You have personal growth. This one should be PG. Okay, the Schussler salt, and then the essential oils. Yeah, so depending on which database you have or you don't have, just use the ones that you have. Now, these are good in dealing with thoughts and feelings, okay? Especially thoughts. And when you do the analysis, you can actually see exactly what are the thoughts that you are having, okay? And how you are feeling and all that. So these are good to stop things at the beginning, okay? At the beginning stages, yeah? Okay, to nip things at the bud, yeah. Okay, please repeat in full forms, okay? All right, AGE, this is Alaskan Gem Elixir. Okay, then you have, I'm following the sequence of the database, all right? Then you have the Australian bush flowers, the bug flowers, creative homeopathy psyche, courage, plant power, which is the new latest one. Then you have the personal growth, and then you have Schussler salts, essential oils. Okay, yeah. So these are good for you to actually deal with your thoughts. And then with feelings, for example, then you have in Healy, you have the soul cycle, you have mental balance, okay? In job, you have activation, you have exhaustion, yeah? Balanced nerve, all this for feelings, okay? For sleep, having good sleep is essential because when you sleep, that's where your body do all the reset, okay? So you can actually reset your whole system again and then purge out whatever that is not good. So sleep is where you can do all this, yeah? And defense is where you actually protect your energetic field from being disturbed by other people's negativity, okay? Yeah, so these are programs that you can use for the first two, okay? These two, interchangeable. All right, then the next one is this one, disrupting energy flow. So when your energy is disrupted through blockages, okay, yeah, then you can use the chakra, the meridians, okay? Then you have the energy cycle. This one is in the obsidian. Then you have the bioenergetic support. So today we're going to talk about the chakra and the meridians. I'll tell you why. Okay, now for the fluids, when the fluids are actually affected, we can use all the circulation programs. You can use the lymphatic programs and digital nutrition mixture. Why? Because when your blood is disrupted in the flow, certain tissues, certain cells doesn't get the nutrition they need. So you can complement it with the digital nutrition. Yeah, okay. All right, then next one, when it comes to the physical cells, the organs, the tissues, and when the organs are not functionally optimally, these are the ones that you will use more for the organs. Okay, gold cycle, deep cycle, bioenergetic harmony, vitalization. Then you have the power of three, classical, physical, classical, energetics. Okay, yeah. Then you have the learning. Okay. Oh yeah, the other one is the Pitta, Vata, and the Kapha. All this is for the physical body. Then you have learning, okay, which is the brain fitness, beauty, skin, local stimulation, which is to manage pain and some of the emotion issues, but majority are for physical pain. Okay, so that's why I classify them under here. Okay, so that means overview of all the Healy programs. This is how I would position or group the different programs, okay, for different stages of the progression of your discomfort or disease. Okay, all right, yeah. So here we are not saying that we are using this to cure. Okay, so don't misconstrue the message. We are always trying to achieve balance, meaning that we are bringing each aspect of this back to its balanced position, okay, by using frequencies, energies, and resonance, okay, to actually communicate with the cells, with the tissues, with the atoms, and all that to reach and achieve the balanced state. All right. Yeah. So the top part here, this has to do with the mind. So everything starts from the mind. So from the mind, if we don't nip it at the butt, it is going to eventually get into the body. So if you remember last week, not last week, my last session, we talked about trauma. Okay, so trauma starts from the event, it starts from the mind, and then from the mind, it actually gets stuck in your nervous system, it gets stuck in your meridians. So later on, it is going to affect your body. So there's always this mind-body connection, which we talked about a few months ago. All right. So if you look at the interface where the two overlap, where the mind and the body overlap, it is actually at the chakras and the meridians. Okay, so that is the reason why, okay, I talk about this. Okay, yeah, because this is the starting point for the body. So once the chakra and meridian starts to get blockages as a result of the negativity that you feel, then it will progress downwards. So therefore, we are talking about chakras and meridians today because we are dealing with the interface at the beginning. Okay, now before things happen, if you talk about prevention or preventive medicine, it is actually here at the thoughts and feelings. Before, if you can clear and get rid of all the negativity right at the top two, okay, then it will not go and flow to the bottom. Yeah, so that's why the top two are very important. All these, okay, try to clear them as soon as you possibly can. Okay, don't delay and don't wait. Okay, now let's move on. Okay, now we do a lot of good things for ourselves, our body, because many of you who are here, you are very health conscious. Okay, you take care of your body. That's why you are here to learn. You are here with your Healy device to learn how to support your body. All right, so we input quite a lot of good things. We input good water, oxygen. We input all the necessary nutrition. And then last week, Petra talked about how all this is actually converted into energy called ATP, which is needed, which is like the energy for electricity in our body, in our house. Okay, so this energy in ATP here is what makes the entire machinery inside the cell work. Okay, but one cell does not work on its own. So the cell will actually have to communicate with the trillions of other cells. And that communication is usually done through chemical signals, hormones, electrical signals, which is the nerves, and then, okay, through the circulation of blood, the lymph. So that's how the whole body is actually interconnected. Right now, at the end of it is the output. The output of all the cells will be the urea, carbon dioxide, toxins, chemicals, and these are all the waste that is trying to get out. Okay, so that's how we keep our whole system, our cells healthy. But there's one thing, even if you do all this right, you may still not get your optimal health unless you have your vital life force. If there's no vital life force, all this may not be useful. Okay, so that's the reason why I keep stressing on these two, the chakras and the meridians, because you must have this before all these things that you do is actually effective for the cells. Yeah. Okay, so this is to drum in, okay, the importance of chakras and meridians. Okay, so that's why you see a lot of chakras and meridians, whether you are talking about Healy, you're talking about MagHealy, you see a lot of this kind of programs, okay, because they are very, very important. Okay, now let's look at the chakra. Okay, we are all quite familiar. Most of us would have heard or are quite familiar that there are 7 chakras here. 1, 2, 3, 4, 5, 6, 7. Okay, so if you look at this and you compare it with the body, so this is the body. I put them side by side so that we can do the comparison. So the chakras here actually covers from where? From your head all the way to the base of your core body, okay, which is the torso. Okay, so head and torso, and that is where all the vital organs are, okay? Yeah, so here you can use, which one? You can use this one, the chakra program. This I put here on the right side. This is the chakra program in Healy. And then this one here is the comparison between the two. How are they related? Okay, now the crown chakra is located at the top of the head here. Roughly the position doesn't have to be exact, but usually is at the top over here. Okay, now how would it cause? What will cause blockage to the crown chakra will be all this. Remember, we said it is always thoughts and feelings. And if these are the thoughts and feelings that a person, okay, or you have had in the past, okay, being mean or unkind in your words, in your actions, it doesn't have to be deeds. You know, the moment you have an unkind thought, okay, or a belief, okay, or words, it is counted that we have already committed it, okay? So that means it already existed in the system. Yeah. So if you have no feelings, shut down, you cannot empathize or feel for people. If you have ever been angry or if you feel hurt by people, jealousy, bitterness, okay? Yeah. So you become self-absorbed if the crown chakra is actually blocked. So it works two ways, you know. If the driving force is this kind of feelings will cause the blockage. And when it becomes blocked, it will trigger this kind of emotions even more. So it's a vicious cycle. Yeah. So greedy, lonely, withdrawn, don't want to be with people, sad, unhappy. Yeah. So these are the emotions that will block. Okay. And if blocked, will also generate this kind of emotions. Okay. Yeah. So if the crown chakra is blocked, what's going to happen? So the position of the crown chakra, so it's very easy. Where the chakra is, you go across horizontally. You just cut the body into horizontal sections. Okay, so roughly it will be here. This portion of the head here. So which is what? Which is your brain, your cognitive function, your learning, your speech, your language, okay, your ability to handle stress, the happy hormones, your mood. So it will affect your mood, okay, whether it's aggression, anger, okay, unhappy, depression, all this, okay, I classify them under mood, okay. I don't have to use many words to describe all of them. So that means any of your issue, regardless of the medical term that is assigned to it, any of the issue that happens around here, you can use the crown chakra to unblock. Okay, simple. Yeah, the next one is the third eye chakra. Third eye chakra is between the brow, somewhere here in the middle. Yeah, so it coincides with this section of the head. Okay, this section over here. Now, if your third eye chakra is blocked, these are the symptoms. It's like, how do you know whether your third eye chakra is blocked? These are the symptoms. Okay, the distractions. Okay, 3Ds: distraction, drama, disinformation. Distraction means that you have a strong desire and pursuit for money. It's not just a normal ambition, but the hunger is there. Okay, yeah, that everything is just very profit, money focus, okay, rather than people relationship when it's out of balance. Okay, that is symptoms that the third eye chakra is blocked. or the more you pursue all this, the more it's going to cause blockage to that area. Okay. Now, are you involved in drama? Are you creating drama? You know, small things, you know, then cry, okay? Yeah, scold people and make things difficult, create guilt for others and all that. So, yeah, so either you are doing it for others or others are doing it to you. If you are inviting or get involved into all this drama, okay, that create a lot of fear, create a lot of ego fighting. Okay, yeah, that's another sign. This information that you get from media, okay, so when it's blocked, you can't tell what is right or wrong, what is truth and not truth. Yeah, so you get this information from media. We feed on the political information. We feed on all these medical terms, diseases, drugs, and all that. Okay, so we believe everything that reaches us. Okay, so all this, if you don't practice your discernment on all these things to find the balance, yeah, we always say that it's the balance. Okay, then it will cause the blockage here, or it will cause all this. Okay, when you feel all these things, it means it's blocked. And when the third eye is blocked, which part of it will also get affected? It will be this part over here, which is the inner brain. Okay, the inner brain here is important. This is your thalamus, which is the speed of your CPU, your brain. Yeah, how fast you process information, this part will be affected. And this is also the part that produces the serotonin, the dopamine, the happy hormone. So this part here, okay, will then cause mood swings, will start to cause depression, anxiety. Well, pineal gland is also somewhere around here. Okay, so it will start to affect your sleep. Okay, then your eyes are located over here as well. Okay, so eyes means anything from glaucoma, cataract, okay, macular degeneration, or it's just the floaters, yeah, dry eyes, any of these things. Okay, so that's why everything is all classified under eye issues. Ears, tinnitus, imbalance, ear infection. Okay, so anything that affect your hearing, affect your nose, your sinus, and a little bit of your mouth over here, and then here, your emotions. This is where your amygdala, okay, your fear and anger and all that. And then your hippocampus here is the memory of all these past fears. Okay, so everything here will be affected, will be magnified, and then everything will be imbalanced. Okay, so it will cause you to have anxiety, it will cause you to have fears and all this. Okay, then the other one is your pituitary gland, your hypothalamus is here, and these are the ones that are maintaining the homeostasis in the body. So all these important control mechanisms, they're all located here at the third eye. Yeah. Okay. Yeah. Okay. Then the next chakra is actually your throat chakra, which is around here. Okay. So how does the throat chakra get blocked? And what will block the throat chakra are these kinds of thoughts and emotions. Okay. Now, how do you know your throat chakra is already blocked? Okay. You go along with the opinion of others. Meaning that whatever people say, then you will just yes, yes, yes. Whether you agree or disagree, you dare not. You fear expressing your thoughts or your ideas, okay, or your own views, because you're afraid of being misunderstood, being disbelieved, or being persecuted, okay, for saying something. Yeah, so therefore you keep quiet, you don't express. So it's because you lack your courage. Yeah. So you refuse to listen to others, okay, or you listen to distorted truth, or you speak distorted truth, okay. Then as it gets worse, it becomes the person will start to lie and create and speak falsehood. Okay, so this is how it actually progresses, become worse and worse. Okay, now what happens when the throat chakra is blocked? So it will be this part over here. Any of the conditions that you have around here, which include the mouth, ulcers, okay, your lips, the teeth, your tongue, your gums, your esophagus, when you swallow your food, your trachea, which is your respiratory tract, okay, part of the neck here, the bones, okay, neck pain, and then your thyroid, which is at the lower part over here, okay, and even the region near your shoulders, okay, at the part there, okay, so all that will be related to your throat chakra. Okay, then comes the heart chakra. So when it's the heart chakra, so you go across, okay, you will see these issues, the tissues over here. All right, now, what will cause blockage to the heart chakra and what happens when the heart chakra is blocked? So it goes both ways, okay. All these issues, okay, being unkind, mean, all these anger, jealousy, self-absorbed, lonely, and all this. Okay, so these are your relationships. Okay, your relationship with people. Is it full of love, joy, empathy, compassion? Yeah, so this is where when your relationships are affected, out of balance, that's where it will affect the heart chakra. So naturally, it will affect your lungs, respiratory issues, okay, because it's also connected to grief. Yeah, respiratory, any respiratory issue, asthma, bronchitis. Okay, so all these are all classified, pneumonia, they're all classified under lungs. We are not talking about those acute, sudden, okay, but if it's a chronic, that means you constantly have issues, okay, pertaining to those areas. Okay, then the heart is also located here. So any of the heart condition, for example, coronary artery, palpitation, okay, your heart rate variability, HRV, okay, yeah, all this is all located here. And then breast issues is also around here as well as your upper spine, your upper back problems. So they are all because of the blockages of the heart chakra. Okay, yeah. Then, okay, next one will be your solar plexus. Okay, so solar plexus here is blocked because the inner child is hurt. Okay, yeah. So when the inner child is fearful, the person becomes aggressive. So if the person is very easily provoked, and then small things, okay, a small provocation result in disproportional kind of aggression, okay, conflict, dependent, cowardice, reliant. Okay, I want to go to the toilet. May please come with me. Okay, so if you see the child or adult, you know, needing other people to accompany them all the time. Yeah. So this is the sign. Okay, very attached to people or things. Okay, they're not throw away. Okay, you don't discard. You start to keep a lot of things. Yeah, and then anxiety, insecurity. Because you always imagine the worst. Before something happens, you already imagine what will go wrong. Yeah, so you can either bully others or become a victim of bullying. Arrogance, accolades means you have an unusual liking for certificates, okay, achievements. Yeah, so you will take courses and all that, and then when you get your achievements, okay, number one in this competitions and all that, so you like to display, you like it to make known and all that. So that means it's out of proportion. It's not the normal kind of, yeah, you need all this certification, but this kind of pursuit actually boosts your self-worth, okay, and your confidence instead of other things. Yeah, okay, so lack of trust, suspicious, you're always seeing, okay, what is their intention, why do they say this? Okay, you're looking for faults in the person. Okay, yeah. Then the other one is you're influenced by others who are better and powerful, meaning that you don't see other people as your equal. Okay, so if somebody is super rich, is a millionaire, then you would pander to whatever that they say. Okay, so they are like, okay, they are your so-called your gods. Okay, if you are your boss, so you will actually bow down to them, okay? Even when you disagree with certain things, you dare not speak up, okay? So you get influence, they tell you what to do, okay? Whatever they say, then you are more compliant. So that means it's no longer an equal. You don't see the person as an equal. Your own self-worth is lower, the other person is higher, so therefore it's compliance without actually thinking, okay? So these are all signs of blockage here. So when it is blocked, what will happen? So you see that it corresponds to this region here, which is your liver. So any liver related issues, for example, the detoxification of the body, fatty liver, hardening of the liver, okay, anything that disrupt your metabolism, your sugar, fat, protein metabolism, anything that's related to blood, meaning what? Your blood sugar, your blood cholesterol, okay, blood toxins, all this, okay, related to blood and nourishment, this will be affected when the solar plexus is affected, okay? All right, now, also along in this region, this is where your gallbladder is located, so it will affect your fat digestion. So after food, if you feel bloated, all discomfort, gassy, all this, yeah, so is the blockage of the solar plexus. Stomach, bloating of the stomach, indigestion here will also be symptoms. Then you have the pancreas. This is the yellow organ over here. So this particular organ produces most of the digestive enzyme. So if your digestion is affected by the pancreas, okay, then it's also a sign of blockages in the solar plexus. And then insulin, glucagon, these are your blood sugar balance. So it's all produced by the pancreas. The spleen over here, okay, it's about the size of your fist, but it's not so rounded, it's flat, a bit flat, but about the size. Okay, is responsible for your immune system. Okay, your blood cells. That means if you have anemia, you don't have enough red blood. Okay, yeah, or any of the autoimmune condition. So it's because of the imbalance of all these organs like liver and then the spleen. Okay, all this has to do with your immunity. Yeah. Okay, so it will be the solar plexus. Yeah, so we support the solar plexus in order to support the organs that is located here. All right, then next one is the navel chakra, where the navel is located. Okay, somewhere around here. So this has to do with the inner child being hurt. Okay, and the person becomes isolated, lonely, withdrawn, detached, aloof, or do not want to feel anything, very cool, okay, or have tight boundaries, don't come close, yeah, or it can be the opposite, very loose, totally no boundaries, yeah, and then you allow people to step all over you, you cannot set your boundaries, or you don't feel belong to a community, you don't feel belong to your friends, your family, your colleagues, and all that, yeah, so it could be the blockage at the navel chakra here. All right. If it's tense, you will feel the lower back pain. All right. If it's blocked, it will affect the intestines. Okay. So it will be your small intestine, your digestion, absorption issues, and then it will be the large intestines. Okay. Where this has to do with your water absorption, bowel movement, your appendicitis. And also at the intestine is where 80% of your immune cells are located. Over here is also your flora, your probiotics. So your probiotics here will also affect your brain because of the gut-brain axis, okay? So therefore, it will be reflected in either anxiety, depression, okay? All this has to do with this area here, around, surrounding the navel, okay? Yeah. Then the next one, which is somewhere around here, is your kidney and your spine. Okay, so that means around your waist area, the mid spine. So if there's pain around your mid spine, okay, it will be the solar plexus and then the navel. Okay, So this region here, if there are any kidney issues, whether it is polycystic kidney or whether it is kidney stones, yeah, all these are all symptoms, but the root of the problem is here. It all started here many years back. All right. Then, okay, next one is just below the navel is the sacral chakra. Now, sometimes we use these two terms interchangeably, navel and sacral. Okay, so you will see that some materials will talk about the navel, some will talk about the sacral. Are they the same? They are very, very close to each other. So sometimes it can just be lumped as one. So here is sacral is just a bit below. Okay, it's between your root and your navel. So that is where your sacral is located. And this has to do with sexuality issues, parenting issues. Okay. Yeah. So this also get affected if the inner child is hurt. So what happens is the person, okay, becomes controlling, manipulative. Okay. Meaning what? You are using sex to control or manipulate the other person. Yeah, okay. So this can happen in SH, sexual harassment, in workplace and all that because of this kind of issues here, okay? It can appear as impotence, fertility issues, okay? It can cause the person, or if the person is very emotionally needy, clingy, okay? Yeah, so when the person goes to work, you get 10 texts, where are you? When are you coming back? And all that. So they don't feel confident. They are not independent emotionally, so they can be too clingy. Selfish, self-centered, gratification, insecure, and guilt. Okay, yeah. So it can block this part here. If it's tense, it will be the lower back pain. If it's very blocked, then it can progress to issues. Okay, but I'm going to lump the root chakra and the sacral together. So I'm going to talk about the root before I talk about the issues because they are very closely connected. The next part is the root chakra, which is at the base over here. Okay, so the root chakra here, if it's overactive, it can cause anxiety because of the security, okay, and your safety. You know, you keep looking out for where the danger may come. So this is where you will over amplify bad things. You know, what if this happen? What if that happen? And it causes a lot of anxiety. If a person easily panic, okay, easily have anxiety, it's because of overactivity here. If it's too slow, you become very unresponsive to your environment, okay? Yeah, you shut yourself out from your environment, then it leads to the other spectrum, which is depressed. Okay, if it's blocked, then you feel that your life is stuck. Okay, no breakthrough. You can work very, very hard, but a lot of things get stuck. Things doesn't progress smoothly for you. Okay, if it's harmonized, then you will have very balanced masculine and feminine energy. Yeah, so if it's imbalanced, you can become overly masculine, means that your desire to go after your goals and dreams and all that is like boom, unstoppable. If you're overly feminine, then it becomes very too relaxed or too dependent or reliant on others. So that is the imbalance. So when a person is balanced, everybody has our own masculine and feminine energy. So when it's balanced, it's just nice. Meaning that when you wake up in the morning, you have the energy, motivation to go to work, to pursue, to do something, okay? And then you also becomes very balanced in the sense that you will also nurture the body, you will also nurture and take care of others. Okay, so it becomes very balanced if it's harmonized. Okay, if it's tense, you get pain at the lower back. Yeah. Okay, so now let's look when these two, when the sacral and the root chakra, when it's blocked, these are the issues that will be affected. Okay, at the sacral area, this is the navel, this is sacral here, somewhere in between. This is where the womb is located for female. Now I'm talking about the female. This is where the womb is located. Any womb issue, any womb uterine issue, fallopian tube issue, this is where fertilization takes place. This is where the fetus, the embryo will grow. And this is where the egg is produced, okay? Hormonal issues, for example, estrogen, progesterone imbalance, okay? Any of the sexual issues, fertility issues, menstrual, pregnancy issues, fibroids, blood clots, cysts, polycystic ovary. Yeah. So all this that is located here, they are connected. Okay. So when the imbalance and blockage is here, it can display itself as any of these issues. Okay. Now, when it comes to the root for the female, it will be this part, the cervix, the vagina issues. Okay. Then you have your rectum, anus, okay, issues like piles, hemorrhoid is all around here. So you can actually use the root chakra, unblock the root chakra. Okay, now let's look at the male. So for the male at the sacral here, this is where the sperm duct is located. Okay, so sperm duct. Okay, sometimes sperm duct can be blocked, so it's going to affect ejaculation. So this is where the fluid, the prostate fluid will flow and all that. So, and sex life, okay, it's going to be affected. Fertility issues can be affected by this. The root will be here because the sexual organs for the male is actually lower down. So the testes, okay, the erectile issues, okay, sperm production is here, yeah. Then, so it will be your sexuality, sex life, fertility issues will be related to sacral and root chakra, okay. And then the same, the rectum means colorectal, yeah. Anus, piles, hemorrhoids, all these common issues, they will be all located here. So therefore, you will just do that. Yeah, bladder issues, whether it's incontinence, high frequency, urinary tract infection, the lower spine, the lower back. Okay, when you sit too long, okay, if yeah, that area is uncomfortable for you. So these are all the chakras that you can unblock. Okay. All right. So it's that simple. You basically just cut your body into sections according to the chakras. So it's very easy. All right. Now, what about the hands and legs? So some will say that what if I have issues on the hands, legs, fingers, my wrist, my knee, ankle, then which chakra do I use? Okay. So for that, we use the meridians. Yeah. So for the core body organs, you can also use the meridian according to the names of the meridian. So you will know. All right. So whatever issue, you just match with the meridian. Okay. So now I'm talking about, let's say, hands and legs. So what kind of meridians can you use for your hands and legs? Okay, so there are 12 principal meridians, and then there are 2 dividing the body into 2 halves, okay, at the front and at the back. But where Healy is concerned, we have the 12 principal meridians inside the Healy device and the MagHealy device, okay? So you see, why are there so many meridian programs in Healy and MagHealy? Have you ever wondered? You know, you have the watch meridian, you have the Healy meridian, you have the MagHealy meridian. Why are there so many duplicates? So this further emphasize for us, okay, it underline, underscore, capital letters, that meridians are also very important, especially when you talk about microcurrent, because the delivery of the microcurrent is usually through the meridians. All right. Okay, now, so you have your 12. So if you count 3 times 4, so 12. The 12 principal meridians are here. But meridian 1 and 2, if you count, this is 10 over here, in total 20, but there's only 12 meridians. So they have actually lumped together some of the meridians. Okay, for example, joints. Joints, later on, you will see, let's say a knee joint, you will probably have to run 6 different meridians. But here, they have actually condensed for you. So this is to address joint, skin, okay, fatty degeneration, connective tissue, allergy, then yeah, hormonal. Okay, these are not actual meridians. These are programs with all the related meridians lumped together into one program. Okay, yeah. All right, now, any issues that you have around the shoulders, okay, shoulder joint, or whether it's your elbow joint, whether it's your wrist or your fingers or your finger joints. Finger joints will be arthritis, okay, osteoarthritis and all those pain around here, stiffness here, trigger finger, all these issues, including numbness. Okay, so you see where your numbness is or where your pain is on the upper side, then you do your lung meridian. If it's in the middle, okay, then it will be your pericardium. The pain is located at the lower 1/3 of your hand, then it will be the heart meridian. Left, right of the body is the same, is symmetrical. Okay, so any of the problems with your hands, so that means if the person have frozen shoulders, you would run and unblock the lung, the pericardium, and the heart meridian, all three that's located here. If you have a wrist problem, you will also do these three. All right, so I would say that any problems that you have around your shoulder joint, and along all these areas here, unblock these 3 meridians and the other 3, the next 3. So there are 6 meridians, okay? So on the back of your hand, there are 3. Okay, the top one is large meridian. Then the middle part here, you have your triple warmer. And then the bottom, you have your small intestine. So if you have a shoulder problem here, stiff shoulder, or if you have a shoulder joint problems, yeah, so you have to do 6 meridians. Okay, all these 6 meridians, just do the unblocking. Yeah, so hand, any problems with the hand, do the six meridians. All right, now leg problems. Okay, if you have leg problems from your hip to your knee joint, to your ankle joint, or even to your toes, any of the toes. Okay, yeah, so it can be joint, it can be the muscle, all the muscles, your thigh muscles, your calf muscles, your connective tissue, okay, whether you have a ligament tear or tendon issues, okay, or even cold tips, cold toes, yeah, any of these things, you can actually do 6 meridians, okay. These 3 actually run on the inner surface of the leg. It's on the inner side of the leg, will be liver, spleen, and kidney. Okay, then you have gallbladder is on the outer side of your leg, and then bladder meridian is on the back of your leg, and then you have in front will be your stomach meridian. So you see, if you have a joint issue, okay, joint issue, let's say if you have a knee issue, why is it that people who may take, let's say, calcium, okay, for their bones, all this, at the end, still have to go and do a knee replacement, okay, is because nutrients itself may not just solve the problem, because there could be all these blockages along here that prevent actually those cells from receiving nutrients. So therefore, we need to do the unblocking. So you can unblock all the 6 meridians, okay, these 3. Okay, if it's the knee, right, means that you cover 360 degrees of the knee. Yeah, so you do the inner side, the back, the front, and then the sides. Okay, so 360 all around there to make sure that the circulation is there. If you have water retention in the feet, so the feet is swelling, so you can do all 6 meridians. Okay, now the shortcut is, okay, when it comes to joints, all this kind of joint, ankles and all that, under meridian 1 and 2, they have the joint program. So that actually helped to shortcut. Instead of running 6 meridians, they actually run 1 program. okay, instead of 6 program. So you can actually use that, okay, as a reference to shortcut. But it would be better if you were to just, you know, just do individually. That would be even better. Okay, now female breast issue. Okay, you may have heard of people who have gone through, let's say, mastectomy and then relapse. And then sometimes they can have relapse 2 times, 3 times, 4 times after all the treatments. Okay, so why is that so? If you talk about energetically, all right, there are blockages around here. So one of the blockage that we saw just now that is going to affect the breast is actually your heart chakra. Okay, now the other one is meridians. So for those, let's say, who have discovered lumps in the breast, okay, you may have gone through surgery or mastectomy or whatsoever. If you go back to your reports, okay, or the scan, the ultrasound scans where they show you the exact position of the lumps, okay, see where they are located. Then you will know, you will work backwards, you will know where the problem is, all right? Now, if the lumps are located along here in the middle of the breast, it is actually the blockage of the stomach meridian. Okay, if it's along the side over here, it will be the spleen as well as the gallbladder. All right, if it's nearer towards the chest, on the inner side of the chest, if the lumps are located along here, it is actually a blockage of the kidney. Yeah, so for breast care, let's say you have young women in your 20s, in your 30s, yeah, preparing for motherhood. Okay, so yeah, we will do a lot of things to prepare. So we can prepare by taking care of the root and sacral chakra over here to do the unblocking. So take care of the breast in the long term is to do the unblocking. So you can also trace, you can either do mechanical massage, manual massage. You can use the Healy to actually do the vibration. Okay, there is also the MagHealy Meridian. Okay, so sometimes I'll just put the MagHealy directly on the breast. Okay, yeah, but you don't put so high. You can put below 50%, 20, 30%. So instead of putting it at the belly, I will just place it here, place it here. Okay, yeah. So that is to work on breast care. All right, okay, yeah. So because the chi flow, the energy flow is very important. Yeah. So when there are blockages here, it is going to disrupt the fluid circulation, which is the lymph and then the blood. So it's going to affect the behavior of the tissues around here. All right. So the misbehavior would then result in forming clumps, okay, forming tumors, all this growth and all that. So the problem is if you don't solve this problem, let's say if it's a lumpectomy, means that, okay, it's a small lump they discovered, they take out the lump, and then after that, you will find that relapse will happen either somewhere here instead of the exact same spot. It will either be above, below, or it will be somewhere else. Okay. If this happens, it means that you are removing the lump without clearing the blockages. Yeah. So the problems will reappear after a few years. Okay. Now for fertility, sexual organs, so you will protect. Just now we mentioned about doing the chakra and the root. So you can also unblock the meridians that passes through the sex organs around here. Okay, so that will be, so that will be the liver, the stomach, spleen, kidney, meridians that is actually passing by this area over here. Okay, yeah. Easy, right? It's actually very easy. All right. So if you have fats accumulation here, if you have tummy and you're trying to slim down. So these are all the meridians that are all along here. So do the unblocking. Okay. So yeah. Then for, let me see, this is what? Okay. Now these 2 meridians, which is the not is not found in the MagHealy, because MagHealy only have 12. Okay, I also do not know whether in Meridians, whether they incorporate these other two, which is the governing and the conceptual conception vessel, which is the black line over here. You see the black line over here in the front of the body, dividing your body into two. And then after that, going behind this black line here. Okay, yeah. So I do not know which one is it, whether it's already included inside or not included inside. This is just for general knowledge that there are two more. So you can either do mechanical, okay, manual massage, okay, yeah, by following this line here in the middle, and then the one along the back. Okay, so this is just for your knowledge where you can do manually, because I'm not sure whether it is included in the Meridian program. So the conception vessel for fertility would be this line here in the middle. And then for immune, those with immune condition, yeah, so you can strengthen your immunity along the back here. If your body is cold, okay, yeah, it actually to raise your body temperature for heat is also the governing, and then the kidney brain axis is also located along there. Now, back issues, spine issues, back pain, including like ankylosing spondylosis, bent spine. Now, if you think of it, why does the spine, okay, actually bend? Okay, blockages. So when it blocked, the energy cannot flow straight down, so it go around it. So therefore, the spine after a long time becomes curved. Okay, so now there are people who ask me, curved spine, can we actually straighten the spine again? So the rationale is this. So I asked them, when your teeth get crooked, because teeth, bones, they are same, it looks hard. But I say, if you have crooked teeth, can you actually straighten it? Yes, you put the retainer, you put all the wires, you have to wear it every single day, including when you are sleeping. And what happens is the wire and all that will force the teeth to slowly move, and they move very little every day, but they can straighten. But how long do you have to wear your retainer? 3 years, maybe? Yeah. So I say, if the teeth actually take that long to actually move the teeth, okay, for spine, okay, curved spine and all that, you have to see the professional, you must have all the proper equipment to straighten the back. Then you have to use that every day and wait for the spine to actually restore back. Okay, it's going to take a long time. Yeah, but if you are determined, then therefore you must be disciplined. So if the teeth takes 3 years, the spine will take much longer. Okay, yeah, but the body, the cells are all dynamic. So the whole body is dynamic and changing every day. So we can actually reverse, but it takes time. Especially when you work on energy, it's not something overnight. It takes a few months for you to actually see the change. But if you're disciplined enough, okay, the reward comes later. Yeah. So for spine, other than doing it on all the 7 chakras, okay, do it on the organ meridian. Okay, there is an organ meridian in the Healy Meridian program, which I suspect, okay, is the governing vessel, but I'm not sure. Okay, the other one that you can use is the bladder. Okay, use the bladder meridian because it runs parallel to the spine. Okay, so for nerves, there is a nerve meridian in the Healy, so you can perhaps use the nerve meridian. Okay, or you can use the bladder meridians to also support the tissues around the nerve, because there are a lot of nerves coming down from your spinal cord. So a lot of nerves actually protrude, comes out from the spine. Yeah, so these are the programs you can use to support your nervous system. Yeah. Okay, so you have all these programs over here. Yeah, I mentioned nerve. Yeah, organ. So okay, so that will be the chakras and the meridians in Healy. Under the MagHealy, I would prefer to use the meridians rather than, okay, we have chakra balancing over here, but I still think that the chakras in Healy might be more specific. Okay, the chakra balancing here, because it's hemisphere, it's not directly on the body. I would, if you have no choice, if you don't have a Healy, you can use this, but this one is more for meditation. Yeah, but you can also try this as well, okay, for the chakras. But it's best that you have the Healy chakras, okay? Now, can you use, yeah, so here you have the chakra, you have the 2 meridian. You can also, don't forget the watch meridian. You can also use the watch meridian. If you do not know which meridian is blocked, then what you can do is you can actually use the Healy Blue app, the Analyze app, to analyze your chakra or to analyze either watch meridian or the meridian 1 and 2. Then whatever that surface in your top 5, you can run those meridian first. Okay, so you can actually try that. Okay, now, do you use the aura, which is also chakra? I would not use the aura like this directly for health issues, for body issues. Okay, I think that might be a slight difference in the frequency used. For body health, I would use this chakra program. But for all the other areas of your life, okay, then you can actually use the aura program. Yeah. Okay. Yeah. So, okay, so we have these 2 wonderful, amazing devices, Healy and MagHealy. Use them complementary, okay, because they have different programs, and because the meridians are actually created by different creators. So I believe there will be slight differences in the combination of frequencies used. Okay, so therefore I use both sets of meridians and chakra programs. All right. Okay, so I have summarized, and I hope I've made things easier and simpler for you. Okay. Yeah, and you just try that. So for when you work with energy, you have to give yourself time. Okay, it's not just 1 time, 2 time, and then you want to see things start to improve. No, give yourself at least 3 months consistently every week. I'm not saying that every day you're going to run it, but every week. Every day you can run different meridian program, but every week, if you were to use 1 or 2 of the programs, okay, over time you will see improvements. Okay, improvements, and very stable improvement that you will see. All right. Okay. So yeah, and one thing to caution is you might feel pain, you might feel discomfort as you run the meridians, because sometimes you may actually feel that you can feel the energy moving, okay, and then it will be like blocked somewhere, and then you will feel the tuk, 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 as the current is trying to push through. Okay, you might get rashes. Okay, you may have a detox kind of reaction. So don't be fearful. You just record down, journal, okay, and monitor the situation. Okay, so it's natural, it's normal to have some slight discomfort. It may last for 2-3 days. Okay, yeah, so just drink the water. Make sure that before you use the meridian, drink water, and after you finish, drink water. Okay, you need water to let the current flow. Okay, so you must be adequately hydrated. Okay, so 2 weeks later, I'm going to see you again. And this time we're going to talk about geopathy, the energy cycle, then the earth program. Okay, now geopathy, a lot of people do not know how to use the geopathic program. Okay, yeah, so, and it's very interesting. So we will talk about planets, we will talk about all these environmental issues that is affecting our health. I call them the silent killers. Okay, so that will be 2 weeks later. Next week, we will have Petra. So Petra will be talking about foundational protocol, okay, for holistic health. So the theme this month is around holistic health, okay? So balancing different parts of our body. So she started last week with the cell, okay? Then I talk about the energy as the foundation, okay? Yeah, so it's interesting. So I hope to see you again next week and every week if possible. Okay, let's see what questions do we have. Okay, there's one question here from Mishra. Can full cataract be removed only with Healy treatment? Okay. Now it depends on what stage you are. Whether you are at the initial stages where, you know, the lens starts the clouding, or are you at the later stage? If it's at the later stage, so this is where you have to get the doctor to diagnose for you, okay? Whether they want to wait or whether they recommend that you change your lens, okay? So for my parents, my mom is in her 70s, all right? So it's already too late for her to use the Healy alone to harmonize. So she actually get replacement for both eyes, one at a time. So she did that and it was so good for her. Okay, after that, it became very, very clear. And then after that, we do the support. Okay, yeah. So you have to let the doctor decide on your situation. Okay, then for cataract, which is the eyes, okay, any form of surgery, it will be skin, cell harmony is always good. And then you have bioenergetic vitalization, which is the stem cells, okay? Yeah, so that is for recovery. Then deep cycle, you have renewal, okay? Anything that is renewal, regeneration, MagHealy, you have regeneration. So those are the ones for use after surgery. Okay, may I use the third eye chakra, but Healy doesn't replace? Yeah, Healy does not replace. So that's why it will always be where you are in that progression of disease. Yeah, so you have to let the doctor decide whether there is time to wait and monitor, or whether you have to immediately take the intervention. Okay, yeah. So therefore, let the doctor decide. Okay, but while you're waiting the whole time, you can always do the balancing. At any point in time, you can always do the balancing. What is fatty degeneration for? Like, let's say fatty liver. Okay, fatty liver, you can use fatty degeneration, abdominal fats, okay, subcutaneous fats. Yeah, so, or you have a clogged vessels, blood vessels that are clogged because of fatty deposits. Okay, so you can use fatty degeneration for that. Okay, I have a question. Have you heard of anyone getting super itchy? Yes, you can get itchy. All right, the fine flow, there are two kinds of itchiness. So fine flow is the capillary flow. So when the capillary starts to flow and all that on the surface of the skin, you can actually feel warmth and a bit of itchiness, okay? Yeah, if after the program is over and you don't feel itchy anymore, okay, it's because of the program, yeah? Okay, so if it's the wrist, okay, the wrist over here, if I were to use a few programs continuously using the electrodes, even my skin here will become very itchy. Yeah, so what I do is I actually use wet tissue. Okay, so wet tissue like this, put water, and what I do is I will wrap it such that I only have a thin layer here, and then the back. So the electrodes, I put them here, so it actually protects. So after I use this method, I don't have the irritation. Okay, yeah. So you can try that method. And because the water, I keep it moist. I keep the wet tissue moist for the current flow. Okay, for current flow. Then okay, I can never get the frequency to show because you can't turn it up. Okay, all right. So you try this method and see whether it helps. Okay, yeah. So if the words appear and you can't bring it up, what you can do is you just wet the tissue, okay? Yeah, you have water, even with lower current, it will still be able to flow very well. So it actually help in the current flow, okay? Yeah, Sanjeev. Okay, yeah, very good. I'm glad you learned something. Okay, how often or how long each meridians to be used? Okay, there is already a fixed timing for each meridian program. Okay, so every meridian has its particular timing. You just use the entire program. Best is through the electrodes, because the electrodes, the meridians are actually microcurrent. So it's good for microcurrent and meridians. Okay, now you can also use the coil. Okay, how often? Probably 2 to 3 times a week. Yeah, not too often and not too many within the same day, because your body will feel very warm, because it actually promotes blood circulation after you use the meridians. So what happens is your body will start to feel warm and you may actually sweat. Yeah. Okay, that's good. Good, thanks. Okay, then Dr. C. Chakra balancing in MagHealy, to use it on the body. Yeah, because it's a atmosphere program. So therefore you don't put directly on the body. You can try putting it directly on the body, let's say on the belly, and see whether you can feel the energy flow or not. But I've not tried that. Okay, you can actually try that. Sometimes I do some experiment on myself. Okay. Would it paralysis after an injury? Okay, would it be any good to add the electrodes up and down of the injury? Yes. Okay, you can, okay, if you're using it on the wrist, you use the wristband. Okay. Now, I have members who actually use the gel. Okay. So the gel, usually you see them telling you to actually paste here and all that. So what the others have tried is, let's say where their injury is, they will actually put on the flanking the two sides of near the injury, okay? But not when you have bleeding. No bleeding, okay? All the wound must be already closed. Okay, one caution is when you use meridian, there must not be any bleeding. Okay, don't use during menstruation or when you have any cut, any bleeding, or immediately after surgery. Because why? It promotes blood flow. Okay, yeah. So make sure that you don't have any of these things. It's way after you have healed from the injury. Okay, so you can actually put in between or closer to the area of the injury that happened in the past. Okay, using the gel electrodes to position them. So I have actually heard testimonials from people who have done that, and the effect was good. So don't be limited by just the wristband. Okay. Such okay, can you please repeat the slides about the books? Okay, hang on. Okay. There are behavioral issues of teen kids. Okay, those who put up your hand, hang on. Let me finish all this first. Okay, if there are behavioral issues of teen kids, then which chakra? Okay, behavioral issues will be the crown and the third eye. Okay, crown and the third eye, especially the third eye, because that is the location of the, just now we saw the amygdala and then the hippocampus. Okay, so these are the two parts that actually regulate the emotions and aggression. And then that part is also important because the happy hormones, serotonin, dopamine, and all that are released over there. Yeah, so you can work on these two areas here. Okay, you can use the meridians as well. Yeah. How to use Healy for blocked throat chakra due to complex chakra? What do you mean by complex chakra? Okay, later, Shiva, you ask that. Shiv Iver, you ask Iyer. Shiv Iyer. Okay, later I'll let you
Sorry, there
elaborate
was
on that. What to use in place of pericardium meridian, which you don't have. Okay, pericardium is in MagHealy. There is a pericardium. Okay, so if you only have Healy, you will just use the heart. And then you do your manual stimulation along your pericardium. Okay, you can just go to Google or ChatGPT or whatsoever just to search for the meridian. So get the accurate ones where you can actually see the meridian points. Yeah, so you can actually use manual massage and stimulation for that if you don't have the program. Okay, Aileen, what kind of practice protocol would you recommend for working with the chakras? I actually start from the bottom up, okay, because there are 7 chakras. Okay, so I start from the root, then the sacral, and then after that, the solar plexus. I start from bottom and move upwards. Then morning, okay, do it in the daytime. Okay, where meridians and chakra is concerned, sometimes the energy flow makes you sweat and makes you very alert. Okay, you become very alert and it may affect your sleep. Yeah, for me, it will actually affect my sleep if I do it while lying down and all that. Then after that, I feel so alert, I cannot sleep anymore. Okay, so you do it at the earlier part of the day. Okay, in what order should the practice be done? Okay, so I've answered that. The sequence, I start from the lower chakras upwards. Okay, complex trauma. Oh, okay, due to complex trauma, blocked throat. Okay, now if there is trauma, I would unblock everything. Okay, if there is trauma, unblock all the chakras because it's a complex emotions. I'm sure you have already have a mix of everything. Unblock all the meridians, okay, and then work on the nerves because the nervous system will be affected. So this is what I would recommend for that. Okay, so you can split up 1 chakra per day, 1 meridian per day over that 1 week. Yeah. Okay, so you have 12 meridians, right? So that will cover the 2 weeks. Don't be impatient and well, let's do 5 meridians, 6 meridians a day. Okay, it's too overwhelming for the body. Okay. And okay, for those with unblocked emotions, they can actually get the emotions back. Some days I will still feel that hey, the emotions came back because it's the release. Yeah. So when I use the resonance analysis, 1 or 2 of the program, like homeopathy will say that I am releasing some suppressed emotions. Okay, and I was actually feeling a lot of the old emotions. So it can actually happen that way. So for those with trauma, be gentle, be gentle. Okay, can I talk about allergy meridian? Okay, allergy meridian for skin allergy, food allergy, allergy to dust. Okay, yeah, allergy to Wi-Fi signals and all that. So you can actually use the allergy meridian, especially for skin. Okay, governing conception, they are not in that programs over there. Then you will just have to do manually. Okay, get the chart and then follow the chart and then you do a manual massage. Okay, you can do a manual massage, you can use acupuncture, you can use heat therapy. Yeah, so go along the meridian for those 2 meridians. Okay, you want me to show the heart chakra slide again? Hang on. Okay, which program are useful after accident surgery? Okay, so after accident surgery, make sure that they have recovered, no bleeding before you use the programs, the chakra and the meridian. So which programs? Yeah, those that I mentioned today, everything that I mentioned today, because you got to train the body. Because surgery, right? When you have a surgery, especially those very invasive, very deep cut, like a hysterectomy or hip surgery, spine surgery, it actually disrupts the flow of the meridian. So that's why people say they don't feel the same anymore after their surgery. Okay, because the disruption of the energy flow. So you actually have to train the meridian again. Okay, so like a river, you know, So if there are some disruptive thing, you pour, there's a, let's say, landslide, and then part of the river was covered. And then what happened is at the upstream, when the water starts to flow down, it will have to find its own flow again. Yeah, so therefore, after accident surgery, when it cuts, there will be disruption. You're going to retrain the meridians to find its way again. So yeah, you have to use all the meridians to actually retrain them. Okay, re-establish the meridian flow. Okay, to remove heart blockage. Okay, this is heart blockage, okay, not heart chakra blockage, but heart blockage if there is, let's say, fatty deposits, okay, too much fatty deposits in the coronary artery or the heart itself or surrounding the heart, fatty degeneration, okay, use the fatty degeneration, use circulation, use heart programs and circulation, okay, to support the blood vessels. Then, can we use Blue app for newborn? Healy does, as a company, Healy do not recommend whether it's Red app or Blue app for children, okay, minimum 12 or 18 years and above, okay, so based on the test that they have done, okay. So I do not know whether you are a new user or experienced user and how confident you are with the Healy and the MagHealy devices, okay. Assuming that you have used for a while and you're quite confident, you can use the Blue app, okay, because Blue app is working on the information field rather than directly on the body. Okay, if not, you can use the atmosphere program and then put the device near to the infant rather than directly on the infant. Okay, because it's very, very, very strong, although we don't feel it that way. Okay, so make sure that there is no direct contact with the infant. Okay, inguinal hernia. Deep scar, small inflammation. Okay, this one I'll let Eva higher. Hang on, okay. What programs to use for a long time? Last question. For a long time, injury, muscle tear, and all that. So there could be scar. Okay, skin, scar, soft tissue. For muscle, you can use all the fitness program, especially deep relaxation, regeneration. Then you can use the SCAR program, and then MagHealy, you use the soft tissue. Okay, because MagHealy, McMakin is very good for this kind of tissue injury because McMakin's program is suited for athletes. Okay, athletes with lots of injury. Okay, or not. So it's for the recovery of the body after injury. Okay, same as the one for paralysis just now that was mentioned. Okay, so the MagHealy, okay, is very good, the soft tissue. Okay, you can use the soft tissue 1 to 4 weeks for injury that happened long ago. Yeah, so that will help to do the internal repair. Okay. Yeah, if not, it will be the regeneration program or the regeneration renewal programs that I mentioned earlier. Okay, how many days do we give this program and how many a day? Okay, if you're using the electrodes, we always say no more than 3 hours a day, but you split them up, the programs. If it's with the coil, it's unlimited, but you have to follow the response of the body. More doesn't mean is better. Okay, so you have to pace them out. Consistency is better than a spike. Yeah, so a little bit of everything over time is better. So that's why you have to be patient because you are influencing the environment. Okay, you are not straight away like it change. Okay or not? Let's say people ask me how long. Okay, you think of it this way. To make a baby, how long does it take to make one baby? 9 months. Okay, from one single cell until you get enough tissue for one baby, it is 9 months. Okay, so for your body to actually remove the old cells and then give birth to the new cells, okay, and they are all over the place in different parts of the organ, you have trillions. So now you are taking away the old cells and making the new cells. It takes time, okay, to get the instruction. After they get the instruction, doesn't mean that the cells are going to work on it. Some cells are very stubborn. You just sit down there, you can give the instruction. I'm sitting down there, I'm not going to move. Okay, so it takes a long time of coaxing, you know, COAX. You got to coax them, you got to talk to them, okay, you got to go and stimulate them. Hello, wake up, please. You know, so it takes time to actually see and make the body move. Because why? Because of habit, because it's stuck, it's fixed. Okay, so you got to make them move slowly. You got to be very patient. All right, so okay, let's hear from those who put their hand up. Are you able to unmute? Can you unmute?
Yes.
Let me see. Cannot, huh? Shift. Okay, let's see. Yeah, okay. Shift, you can actually unmute.
Yeah, thank you, Christi.
Yeah.
Appreciate the wonderful presentation. That was so insightful. I wanted to ask you something regarding a personal issue that I went through in 2022, June. I had a minor stroke. And that actually affected the thalamus area of my brain. And since then, although I didn't go for any physiotherapy, there was some weakness in the right side. And then later I got over the weakness, but still I have some numb feelings and then some tingling feeling at the end of my fingers.
Which one? All your fingers or certain fingers?
All the fingers, all the
Okay.
fingers. Initially, the palm and the back of the palm was all paining, but now the pain has come down. But I still, when I do like this, there is still a numb feeling, and I feel something is blocked or stiff. How can I overcome this?
The meridians. Yeah. So the hand meridians, there were 6. Okay, go and work on all the 6 meridians. Okay, the numbness here is because of the blood flow, insufficient blood flow. Yeah. So you know, stroke. Why after a stroke the hand cannot move is because this is where your heart meridian is. The heart meridian is here. Yeah. So because it's the blockage. Yeah. Okay. So that's why. So you have to do the unblocking using all the 6 meridians that I show you that's on the hands. Yeah.
One more thing, the doctors, the neurologists told me that in that part of the brain, the thalamus area of the brain, a lot of cells, like thousands and thousands of cells, have probably got destroyed because of the stroke, right? Is there any way I can regenerate those cells using healing?
First is, do you believe what the doctor said?
I had to believe because I didn't know anything better.
If you believe, then no.
Okay.
Because your body will respond according to your belief.
But I'm open to new beliefs.
Yes. So first you got to change the belief. Okay. What I believe is the body is dynamic. Okay. So because if you use the regeneration, all the regeneration program, okay, you can use the MagHealy regeneration, you can use vitalization. The vitalization is very important. You have regeneration 1, regeneration 2, regeneration 3. So you got to do all these 3 because this one is to stimulate stem cells to grow. Yeah. Talk to your body, talk to your brain. As you use it, before you use it, your intention. Okay, that all these regeneration 1, 2, 3, which actually prime your stem cells. Okay, so you talk to your brain cells. Okay, that you will receive them. Okay, that you will act upon them. Okay, and you will regenerate the brain. Yeah, so MagHealy also have the brain and the thalamus program, and then use the nerves because the brain tissue has a lot of nerves. So you got to regenerate all this as well. Under vitalization, you have nerves, you have the something about the support, okay, holistic support, and then you have the epigenetic and all that. Use the entire bioenergetic vitalization.
Okay.
Yeah, a full one. Because it's not just the brain cells that you got to regenerate. Okay, let it work on the whole body.
Sure.
Yeah.
And do we get a recording of this call?
Yes,
By-
yes. The
Okay.
recording will be available. Okay, so you can, I will put them at Use Healy. You go to Use Healy with Christi in the YouTube.
That would be really great.
Yeah. So
I could
yeah.
make a lot of notes, but I still missed out on something. So I
Yeah,
would
so
back and listen.
I normally put it there because the company one you have to wait for one whole
Mm.
month before you
Mm.
actually use it. For
Right.
those who wants to know about the books, and yeah. So this is for the books. Okay, you can go to the YouTube to go and read up on it. Yeah.
Sure. Thanks so much.
Yeah,
Thank you.
you're most welcome. So all the best for your recovery. So the
Thank you.
intention must be very, very strong. Once you intend it, the body actually follow you. You are the master, you know. So the body, the cells actually respond to what you tell them. Yeah. So don't use, and then you see like let's say even the coach. You can even use coach for your condition. I don't know whether you have the coach module. You can put it down there.
I've seen that.
Yes. So your intention, your belief, and your positivity plus the frequency is going to amplify.
Sure.
Yeah.
Sure.
Okay.
Thank you. Thank you.
All right. Okay. Next one, we have Dr. C.
Yeah. Hello.
Yes.
Hello. Am I audible? Am I audible?
Yes.
Yes. Christi, it is a wonderful presentation. Basically, I am an acupuncturist.
That's great.
But the presentation is so nice and so crisp. It is very, very easy to follow everybody. We need not be an acupuncturist. You have such a way that really we have to compliment you.
That's the job of a teacher. Okay, the teacher is supposed to make complex into something very simple.
Such a complex subject, you have given that very simple way. Everybody can follow it. This one. Then you have already answered regarding the chakra balancing in MagHealy. Because the majority, if you analyze the chakra, almost the majority, it is an imbalance condition. Whether we can use the chakra balancing in MagHealy to balance the chakra.
Okay.
That
I
is the
haven't, I do that for my meditation, for my relaxation. Okay. So yeah, yes, it helps to actually do the balancing. Okay. But I haven't compared whether compared to those that is placed directly on the body, whether, you know, whichever is more effective, I do not know. And I'm not that sensitive, so you all can try it. Okay, maybe you all can try it both ways. Either put it atmosphere or just take the MagHealy and then put it on your belly and then run the chakra balancing and see whether that helps. Okay, yeah. So you can try that. I tend to do a lot of experimentation. You see, that's why don't believe me. Don't listen to me. Okay, I stretch. I stretch. Yeah.
Then here the Meridian program, that governing vessel and conception vessel is not there. That is out of 12 plus 2, 12 Meridian are there. Then the conception vessel and governing vessel is not there. Suppose if there is any problem, but you are told to massage the area, whether that is the answer. No, that is the thing. Because since it is absent, governing vessel is not there and conception is not there.
Yeah.
So if suppose if there is any problem, we can do the massage or any other.
Correct. Yes. You just do your own manual massaging.
Then for this one, that for all the neurological problems, acupuncture works well in all conditions, but especially in the neurological condition, it does the very magic work. Because I have treated a lot of stroke patient. A stroke patient, that is wonderful relief for them. Then for facial paralysis, the dementia, a lot of condition. Then Parkinson, it gives a wonderful result. Then for weight reduction, because that thing, it gives a wonderful result. But we find the acupuncture is giving wonderful result as far as that all neurological issue. Yeah, it gives the
Okay.
result. Other condition also, there is no doubt about it. But
Okay. The conception, is it? The conception vessel? Okay.
yeah. This one we use very wonderful. Then regarding the book, what thing just you can display in that. Just you can inform, or otherwise just you can put rely on the chat box. So that
Yeah. I put it in the chat already. Yes.
chat box very useful. So wonderful. Thank you so much for giving this
Yeah.
wonderful.
Thank you. Thank you for your sharing. Thank you, Dr. C.
Thank you.
Yeah. Okay. Chitra Patil.
Yes.
Okay.
Yes, ma'am. My
Yes.
camera is not working, so I'm sorry for that.
Okay.
Yeah.
Yeah.
I have actually issue, congenital heart issue.
Congenital what?
Congenital heart issue.
Heart issue. Okay.
Heart disease. It is called as a tetralogy of Fallot, for which I was operated. Okay.
How long ago? How long ago?
First surgery was done at the age of 3, and the second total correction was done at the age of 15 years.
Oh, 15 years. Oh, that's a very long time ago.
Okay. Then back 10 years, 10 to 12 years back, I was operated for pulmonary valve replacement.
Say again, pulmonary
Valve replacement.
valve replacement. Okay.
Yeah.
Yeah.
Okay. As of now, I have no issues. But I just wanted one thing to understand. In my condition, there will be the right ventricular hypertrophy. The muscle of the ventricle will be hypertrophied. So do I have any chance of regenerating it or making it more, is there any chance that I can correct it?
Yeah, as long as you believe, okay, you're willing to discipline yourself to actually do it. Okay, you see, yours is the blockage of the heart chakra. Okay, you see, it started with the heart issue, right? Then after that, it will be the pulmonary valve replacement and all that. So no matter how you correct, it's around there. So it will keep coming back. After this, it will be another issue. After that will be another issue because the blockage is there. Yeah. Okay. So work on the heart chakra, but you have to be a bit careful. You don't use a very strong percentage of the current. Okay, you start with probably 5%, 10%. Okay, slowly, because you cannot just work on it very hard, especially your pulmonary valve is also not that strong. Okay, I don't know how stable is your condition right now. So be very gentle when you use
Actually,
the
pardon me, last month I did my annual checkup. Everything is good. And I'm using Healy from past 6 to 7 months. So it has given me a good result.
Yeah.
I'm very happy with that. Just that the thing is only the hypertrophy of the thing I need to just work on more, I feel.
There is, okay, the chakra, your heart meridian, okay, which is around here, your hand here. And then there is another one. In MagHealy, you have the pericardium. Work on the pericardium as well. In the blue app, under Analyze, there is a watch program.
Okay.
Okay, the watch program, if you have scanned it before, it talk about your heart rate variability, rigidity, okay, or whatever tension, pressure, and all that. You will be able to be more targeted at the heart. Watch program. Okay, there's watch, and then I type in the chat now. The other one is the watch DN. Watch DN is the digital nutrition for the heart. These are the two programs that are targeted towards the structure, the organ of the heart, very direct on the heart. Yeah, so you can use this. Okay, yeah.
Yeah. How many times and what duration?
How many times? Okay, for the heart, one program a day. You can choose any of the different heart ones to support, but one a day. Yeah, don't go very intense. Don't use very high percentage. Slowly. Yeah, so you have to use, and then you watch your heart, whether you get palpitation or whether you get discomfort and all that. So you got to slowly ease the heart. Yeah, to become more adapted to receiving the energy. Yeah.
Thank you
Okay.
very much.
Yeah.
Thank you. That presentation was awesome.
Thank you.
I'm overwhelmed.
Yeah, so if you use it, because for energy, you got to use it very consistently. That's the main thing. Is consistency. Yeah. Okay, Pretty a
Thank you.
question here. If someone is feeling low on energy overall, do we run all Healy or specific? Okay, you can always do the all Healy to see the percentage first. All right. Specific is always good because it's more direct on the person. Yeah. So when it's more direct, then the change is immediate. Okay. So if they feel low and all that, certain programs that you use, either is mental balance or whether you use the deep cycle programs and the blue app. Okay, within 10 minutes, sometimes the negativity is gone. Yeah. Okay. So direct one will be like the anxiety, the depression. Okay. These are the programs that you can use. Soul Cycle, under Soul Cycle, there's a happy there. Yeah, so you can use the happy program. Yeah. Serenity, all this you can use. Yeah. So watch program, yeah, they are not pink. So you have to do the remote one using the blue app. Okay. Yeah. All right. So thank you so much. Thanks for all your questions and thanks for staying all the way here. I hope that you have learned a lot. Yeah. So this is my bio lesson. Okay. All right. Bye-bye.